Make sure that you guys are
Yeah. 6 feet apart. I could be the bag holder. No, that's good. No, don't. It's fine, the volume. Jennifer.
Good morning.
6 feet apart. Maintain social distance. Yeah, I know.
Hey,
Good morning.
so they're gathering around the podium right now, so it could be any moment.
Do you want me to wait?
I just want to make sure it's on.
Are you able to hear me?
I hear you.
Okay. Let me know. You ready? All right. No, don't worry, no worries. I just want to make sure we're good. All right, here we go. So thank you so much for joining us this morning. I'm very proud to be here with all of you, and I want to thank Chula Vista Mayor Mary Casillas Salas, Councilmember Steve Padilla, Mr. Scott Evans, CEO from Sharp Grossman Hospital, and from the County of San Diego's Health and Human Service Agency, Chief Nursing Officer Denise Foster and Ms. Jennifer Batsford-Coons. As the county continues to make sure that we're getting as many people vaccinated, we also want to ensure that we are distributing these life-saving vaccines as quickly and safely as possible and equitably to defeat the coronavirus so we can all get back to our routines. Due to some of the recent actions taken by the board, we are prioritizing making sure that health equity is a component of our COVID response, meaning that any of the future investments, including vaccine distribution, is going to be made in communities that where the highest need is in the region. And we're going to do this based on science and data. Since the start of the pandemic, our communities throughout District 1 have been disproportionately impacted, specifically in the city of Chula Vista. The city continues to see high rates due to many reasons, from many of the residents being part of the essential workforce that have kept our city and county going, to the lack of access to healthcare. Since day one in office, my goal has been to ensure that more community pods open throughout the South Bay, including a superstation, to help us move through phase 1 quicker and to make sure that our communities get the treatment that they need. So today, I'm proud to announce that at 10 a.m. at this building behind me, we're going to serve as a vaccine site for our community. We're going to begin to operate the county's second vaccination superstation, and this is the first one of its kind in the South Bay. I'm thrilled about this operation because it was made possible not only through the work of the county, the city of Chula Vista with the mayor's leadership, and Sharp Healthcare. Starting today, this site will begin to administer vaccines. Of course, right now we're still in phase 1. That includes healthcare workers, long-term nursing facilities, and individuals that are 75 and older. In choosing a site for the superstation, we wanted to make sure that it was a location that was familiar to our communities. We wanted to make sure it was close to transportation. And I think many of you know that this site has been serving as a testing site for some time now. And so our communities know that this is where they need to go. I do want to thank the mayor of Chula Vista, and I'll be introducing her in a minute, but I want to make sure that I say this also for our Spanish speakers. Esta mañana estoy muy orgullosa de poder anunciar la apertura de la superestación de vacunación aquí en la ciudad de Chula Vista. Esta superestación es la segunda de su tipo en el condado de San Diego. Debido a acciones tomadas recientemente por la Junta de Supervisores, hemos estado trabajando para darle preferencia a las comunidades que más lo necesitan. Sí, se puede, desde el comienzo de la pandemia, el COVID-19, las comunidades del Distrito 1 fueron sumamente impactadas. La ciudad continúa trabajando y viendo que hay un gran porcentaje de casos de COVID, y esto se debe a muchas razones, entre ellas que muchos de los residentes son parte de la fuerza laboral esencial de esta comunidad. Nuestras comunidades son las que han mantenido la economía a flote durante esta muy difícil pandemia. Mi meta desde el primer día fue poder abrir más sitios de vacunación y una superestación en el sur del condado. Al elegir este sitio de superestación, nosotros sabíamos que nos queríamos asegurar que fuera un lugar que fuera familiar para las comunidades y que hubiera transporte y acceso. Además, Aquí es donde muchos de nuestros miembros de la comunidad han venido a tomar los exámenes del COVID, entonces conocen el área. Le agradezco mucho a la alcaldesa y al Consejo Municipal de la ciudad de Chula Vista por su liderazgo en poder hacer esto posible junto con la colaboración de Sharp Healthcare. Por ahora, la superestación solo estará dando las vacunas a personas elegibles de la fase 1A, a todos aquellos que trabajan en los cuidados de largo plazo y a las personas de 75 años en adelante. Now I'm going to invite Mayor Casillas Salas from the city of Chula Vista to join us and say a couple of words.
Thank you. Thank you so much, Supervisor Vargas. It's such a pleasure to have all our partners here today. Our city, our county, our world has been through some extremely tough times in 2020. But with the approval of the vaccines, we finally see light at the end of the tunnel. Chula Vista has been especially hit by COVID-19, and we have lost too many to the terrible virus, including some of my own family members. While the rollout of the vaccine has seemed slow, it's collaborations like this one that we are announcing today that improves access to a life-saving vaccine that will allow us to return our kids to school, reopen our businesses, and rebuild our economy. During this crisis, our city staff has really stepped up and adapted quickly to meet the demands of the moment of crisis, and today is no exception. We have so many of our staff members that have participated and worked to make sure that we bring healing to our community. And there are too many to mention individually, but I do want to point out our director of Emergency Services, Marlon King, that has been so instrumental. Thank you, Chief Munns, for all the work that our firefighters have been doing, and also to Chris Scott, who is also within our fire department. Through a partnership with the County of San Diego, we opened a COVID-19 testing site in October in our South Chula Vista Library. Since then, we have performed over 35,000 tests. Our city, our county, and our world has been now at this South Bay Vaccination Superstation. Our Chula Vista Fire Department and firefighter paramedics will be administering vaccines to eligible residents. Thank you to the County of San Diego, especially our very own supervisor, Vice Chair Nora Vargas, Sharp Chula Vista, Chief Executive Officer Pablo Velez, Sharp Grossmont, Chief Executive Officer Scott Evans, and our Chula Vista Fire Department. Also, a special thanks to Seritage Growth Properties and Brookfield Properties for allowing us access to this space since May to offer COVID-19 testing and assisted with logistics essential to this operation. Lastly, for those who have lost a family member, a friend, or a loved one to the virus, we mourn with you and ask all our residents to recommit themselves to working to end this pandemic. Stay safe and mask up, Chula Vista. Together, we are making progress. And with that, I would like to introduce Council Member Steve Padilla, who has successfully gotten through a very terrible bout of the coronavirus. Please welcome Steve to give your examples.
Thank you, Mayor. Thank you, Supervisor. I want to just express my gratitude for the ability to share a couple of words in this moment. Expressions of gratitude and hope. This is the kind of collaboration that is going to be required not just in underserved communities and communities hardest hit like ours here in Chula Vista and throughout South Bay, but frankly, in the coming weeks and months throughout our entire state and in our entire nation. I want to express my gratitude to Supervisor Vargas for her leadership, for the county's leadership and coordination with local governments here especially and throughout the region. Certainly to our Mayor, Mary Salas, our City Manager, Maria Cachadorian, and our amazing staff, our Brookfield, our amazing private partners, and certainly to Sharp Healthcare. and to many diverse staff, including the firefighters here that are going to be helping to get shots in the arms of people who need them very badly. 10 months ago, nearly, this virus nearly took my life. I was in a medically induced coma on a ventilator for 11 days and nearly did not come home. I'm thinking in this moment about how important this kind of collaboration is to prevent sickness and death and to keep people from losing the ones they love. I'm also thinking in this moment about the 400,000 plus Americans, more than were lost in World War II, to this virus. Many, many of them unnecessary casualties of a lack of leadership and coordination of the kind you are seeing here in this place, in this moment. So Supervisor Vargas, Mayor Salas, I want to express my gratitude for your allowing me to express these sentiments. I want to express my gratitude to all of our partners, to all of you for the work that you are about to do to keep our community healthy and safe. There is much more work to do once these doors open, but we now will have a large center 7 days a week with high capacity to get shots in the arms. We still have work to do to make sure that supply chain is clear and capable so that when we're ready, the state's ready, and our producers of these amazing scientific advancements and vaccines are ready. So at this time, I would like to welcome and introduce Scott Evans, Dr. Scott Evans with Sharp Healthcare. Please make him welcome.
All right. Thank you very much to the mayor as well as our county supervisors. Sharp Healthcare is certainly thrilled and very very elated to be able to help the community here in Chula Vista. I've been asked to describe really what the operations will look like today. And so this is set up as a super center, as we said. Right now we are scaling it to be able to deliver 5,000 vaccines on any given day. And we do believe we can even scale up higher than that. And so this is really built out for even a higher capacity. We will start today with 1,800 vaccines being given. Those were by appointment only. It is important that people do make an appointment to come in, and so that way they can be screened when they get here. We are providing, of course, along the same phasing that is approved by the county, which are healthcare workers, long-term care residents, as well as those that are greater than 75 years of age at the present. And as the eligibility tiers change, we will flex as well. We have today, people will queue up and they will be socially distanced. They will go through a short screening process. They will enter a registration area. That registration area at max will be staffed with 20 people that are registering. We have bilingual folks that are on site. And then they will move to one of 40 vaccination stations before they get to a monitoring station of several hundred that where they will sit and be monitored for 15 minutes to make sure that they do not have any reactions. Of course, if they do have reactions, we are prepared for those reactions with an intensive monitoring station, as well as a plan to send patients or people that are being vaccinated to appropriate emergency medical services. I would like to thank the fire department for working so closely with us. Sharp is very proud to be the operating partner for this venture, and we absolutely have confidence that we will be very successful in vaccinating the folks of Chula Vista and South Bay and greater San Diego area.
So just a reminder to everyone, this is really, it's important for folks to remember that in order to come and get the vaccine, you must make an appointment and you must fall under the category of first phase and or 75 or older. You can go to vaccinationsuperstationsd.com to be able to get that information. We know that I do want to acknowledge that some folks have had some challenges with the website. We are working on it as a county to make sure that people can get what they need. Please don't forget, it's really important that people continue to do, even when they get the vaccination, it's really important that they continue to wear their masks, that they continue to be 6 feet apart and social distancing. A todas aquellas personas que no se les olvide, porque es muy importante, que hay que usar la página web vaccinations superstationsd.com para poder hacer una cita, para poder venir a tener la vacuna. No se les olvide que aunque les den la vacuna, tienen que seguir usando el cubreboca. Y es importante que no nos reunamos con las familias, que sigamos haciendo ese trabajo que tenemos que seguir haciendo para que estemos saludables y podamos salir de esta pandemia. Muchísimas gracias. We'll take any questions. You can do that individually as well. Why don't we do that? Thank you very much. Thank you, everyone. We should just stand. Devana. Oh. Could you take a picture?